Stomach pain is something almost everyone deals with, but the location, type, and timing of that pain can mean very different things. In this video, I'll break down the most common causes of stomach pain, what they usually feel like, and the warning signs that mean it's time to see a doctor. Let's get into it. Stomach pain in the upper abdomen, often felt right below the ribs. What it feels like: a burning or gnawing sensation, sometimes with bloating or nausea after eating. Causes: indigestion, gastritis, acid reflux, or eating too fast or too much. Typical relief: antacids, smaller meals, avoiding spicy or fatty foods, and not lying down right after eating. Pain in the lower right side of the abdomen is one to pay close attention to. What it feels like: starts near the belly button and moves to the lower right, often worsening over hours. Can come with fever, nausea, or loss of appetite. Cause: this is the classic pattern of appendicitis. What to do? This needs urgent medical attention. Appendicitis can become dangerous if the appendix ruptures. Pain on the lower left side has its own set of common causes. What it feels like: cramping or steady pain, sometimes with fever, bloating, or a change in bowel habits. Cause: often linked to diverticulitis, inflamed pouches in the colon, especially in older adults. Treatment: usually antibiotics and a temporary change in diet, guided by a doctor. Crampy come-and-go pain, IBS or gas. This next type is extremely common and usually less serious. What it feels like: cramping pain that comes in waves, often relieved by passing gas or a bowel movement, can be paired with bloating. Causes: irritable bowel syndrome, IBS, trapped gas, or food intolerances. Management: diet tracking, fiber adjustments, hydration, and stress management. Pain under the right ribs, especially after eating fatty food, points to a specific culprit. What it feels like: sharp or cramping pain that can radiate to the back or shoulder blade, often triggered by fatty meals. Cause: gallstones or gallbladder inflammation, cholecystitis. What to do? If pain is severe or comes with fever, this needs prompt medical evaluation. Generalized pain right around the belly button often has less specific causes. What it feels like: dull, aching, or crampy pain in the very center of the abdomen. Causes: early appendicitis, gastroenteritis, stomach flu, or general digestive upset. Watch for: if this pain shifts to the lower right side, it may be progressing toward appendicitis. Seek care. Warning signs: when to worry. Most stomach pain resolves on its own, but some symptoms mean you should seek medical care right away. Severe, sudden, or worsening pain, pain with a hard, rigid abdomen, persistent vomiting or vomiting blood, blood in stool or black. Management and prevention recap. To lower your risk of everyday stomach pain, eat smaller, slower meals. Stay hydrated. Limit fatty, spicy, or processed foods. Manage stress. Track patterns if pain is recurring. That's a full breakdown of the major types of stomach pain and when they're worth worrying about. If you want a video on a specific topic, let me know in the comments. And don't forget to subscribe for more health breakdowns.